Hello, I'm Otilia Mårdh. I'm presenting on behalf of colleagues from ECDC and from the WHO Regional Office for Europe. In recent years, every 1 in 3 persons diagnosed with HIV infection in Europe is a woman. Since men are predominantly affected by the HIV epidemic, they are also predominantly targeted by prevention efforts in many countries. We aimed to describe the demographic and clinical characteristics of women newly diagnosed with HIV in Europe and identify risk factors for late diagnosis in order to provide enhanced information for targeted prevention. ECDC and WHO Europe are jointly organizing the HIV surveillance at European level. Data reported from the European countries are stored in the European surveillance system called TESI. We extracted all cases of female gender reported for the most recent year available, 2018. We produced summary statistics for age, transmission and migration status and compare the cross regions, sub-regions. We used logistic regression to test the association between late diagnosis and age, transmission, and migrant status as potential risk factors. In 2018, there were almost 50,000 women newly diagnosed with HIV infection in Europe. Most of the cases, 86%, were reported from the East sub-region, followed by the West with 12% and 6,000 cases, and the Center 2% and less than 1,000 cases. Overall, in the European region, there were 11 new diagnoses per 100,000 female population. Notification rate varied across sub-region. Highest in the East, 33 women newly diagnosed with HIV per 100,000 females, and lowest in the center with 1 new diagnosis per 100,000. There were also variations within sub-region, with the East displaying the largest variation in the notification rates. Highest rates within the European region were in the Russian Federation, 43, followed by Ukraine, 32 new diagnoses among 100,000 female population. So, what is the demographic and clinical profile of a woman diagnosed with HIV in Europe in 2018? According to the case-based data available, it was most likely that she was diagnosed in the East, was between 30 and 46 years old, infected from the male sexual partner, native of the country where she was diagnosed, and with a 54% chance to be diagnosed late. Looking across sub-regions, there was no significant variation in the age at diagnosis, neither in the proportion of women diagnosed late. Heterosexual transmission was the predominant mode of transmission in all regions. Only in the East, 8% of the women were infected through injecting drug use, and this was a significant difference, significantly statistical difference. Variation in migration status was large. In the Western Europe, 2/3 of the women were migrant women, in contrast with less than 1/3 in the center and almost no cases among migrant women in the East. Here are the results of the risk factors analysis through logistic regression. Older age was associated with an increased odds of late diagnosis in all subregions. More specifically, women in the West older than 50 years were 4 times more likely to be diagnosed late. Similarly for women in the East, while progressing through age, the risk of diagnosed late increased. IDU transmission reduced the likeliness of being diagnosed late in the East, likely due to increased testing targeted to this population. Migration status had no impact on late diagnosis, which is hopefully an indicator of good access to testing of migrant women in the West. Here is a comparison of trends by transmission for women and men by subregion. The IDU transmission in yellow is decreasing or is stable at low levels in all subregions. Heterosexual transmission is decreasing in the West, mainly due to reduction of cases among migrant populations, and is increasing in the East. In conclusion, the HIV epidemic among European women has different magnitudes in the three subregions. In spite of this, most women in any subregion are infected through transmission from their male partner. Because half of the women are diagnosed after the age of 37, it is less likely that antenatal screening programs will cover the need for testing of this population. Surveillance data are scarce to understand the social, demographic, and behavior risk factors that place women at risk of HIV transmission and late diagnosis beyond an older age. Enhanced demographic and behavior data about women and their partners are needed to inform prevention strategies. Thank you for attention. More details about this analysis are available in our article published in Eurosurveillance.